Good morning and welcome to the session, the last session in the chapter 8 infrastructure. We are going to understand the various factors in healthcare. Already in the previous video we were studying about the health infrastructure, and today by ending of this chapter by discussing the various topics, and let us try to understand the topic for today, that is urban and rural and rich and poor divide. So in our country, how in the urban and the rural area the health infrastructure have been classified, how far we have reached in the rural areas. We know already that our country is a nation of villages, and more than 70% of the population they live in the rural areas only. And one fifth of the hospitals are available in rural areas, half of the dispensaries, and out of that, about 6.3 lakhs beds in government hospitals, and roughly that is 30 percentage available in the rural area. Thus people living in rural area do not have the sufficient medical infrastructure. They don't have a medical infrastructure, yeah, like hospitals, good machineries, equipments, and testing of bloods and various paramedicals, and many facilities are not available. This has led to the differences in the health status of the people, like urban and rural. It has been divided. There are only 0.36 hospitals for every 1 lakh people in rural areas. That is very less as we compare to the, already I told you, 70 percentage of the population live in rural area. That means the remaining 30 percentage are living in urban areas. In the urban area, though, we have 3.6 hospitals, but for every 1 lakh people, and in the rural area just 0.36 percentage of a hospitals only were available. So that you can understand how the urban and the rural health infrastructure have been divided. Not only that, the primary health centers located in the rural areas do not even have the x-ray or a blood testing facilities. So that is very cruel sometimes to do the testings. And for a city dweller constituted basic health care, so city, those who are living, they available all the facilities, whatever the facilities they require. Not only that, states like Bihar, Madhya Pradesh, Rajasthan, and Uttar Pradesh are relatively lagging behind in the healthcare facility. These states are don't have a proper facilities in the health infrastructure. In the rural areas, the percentage of people who have no access to proper care has increased over the last few years. We don't have a proper healthcare facilities in the rural areas. We can also see to few things. Villages have no access to any specialized medical care. We don't have a proper medical care, like pediatrics, gynecologists, and anesthesians and obstetrics. In this, we don't have a proper specialized medical care in the villages, but in the cities it is available. And even though 380 recognized medical colleges produce about 44,000 medical graduates every year. Every year, 44,000 medical students are coming out. Though we have every year 44,000 graduates, means imagine how many doctors will be there in our country. That is nearly, it is only recognized 380 colleges. Think over how many every year the graduates coming out. But though we are facing a shortage in the doctors in the rural areas, in the villages, we don't have a proper doctors in our country. So one fifth of these doctors, they leave the country for a better monetary benefit, for good salary. They move abroad, they work in different countries to get a higher wages. Not only that, if suppose they don't go outside, and also the doctors, they prefer to work in the private hospitals but not in the government hospitals and the PH centers, that is primary health centers and community health centers. Many others opt for a private hospitals which are mostly located in urban areas. Then in the rural area, where will be the doctors? And what happens to the sick. And the poorest in the country, nearly 20 percentage of the poorest Indians living in both urban and the rural areas, they spend nearly 12 percentage of their income on healthcare, while the rich spend only 2 percentage. And what happens when the poor fall sick? So what will happen if the poor people fall sick? Many have to sell their land or even pledge their children to afford treatments because they don't have a money. Poor people, first of all, they lack for food, shelter, and clothing where they can offer for treatments. And since government run hospitals do not provide sufficient facilities, the poor are driven to the private hospitals. So, and many people die because they don't have money to take them to the multi speciality and super specialty hospitals. This is what the condition of urban and rural and the rich and the poor people divide in the healthcare infrastructure in our country. Along with this, we are going to study also about the women's health. See, women in India, they consist of half of the total population in India. And what are the problems? What are the disadvantages they face? What are the disadvantages we have in the women's care? Let us understand today. They suffer many disadvantages as compared to men in the areas of education. In education, if you take, there is no equivalent education. Many households, they speak about the tradition, they speak about why we should educate the girl children. She is going to get married and goes to some other's house, why we should spend money for the education purpose. And participation in economic activities, also in the production, in manufacturing, more number of women are not involved. In the service sector, many women, they are not encouraged. So we can find the disadvantages in the education and in the economic activities. Not only that, even in the healthcare facilities, this is one of the drawback in our country. The another important point we are going to discuss, that the decline in child sex ratio, that means how many number of male is to females in our country. For every 1,000 male, how many number of females are there in our country? Means 927 females. Actually it was very less earlier, but now the few women empowerment programs and many more programs have encouraged the girl children in our country. And also our prime minister have introduced one of the important scheme for girl children, that is Beti Padhao and Beti Bachao, that is save girl child and educate the girl child. Under that scheme there is a saving system. So now in our country there are 927 in 2001 census, and 2011 it has been reduced to 914 for every 1,000 male child. How many female child? Means 914, that is 2011 census. Points to the growing incidence of female foeticide in the country, that means killing of girl children. Earlier it was more in number. If girl children means they see as a curse, and the old people and many hospitals, they used to kill the girl children because of dowry and for marriage, for education, who will spend so much of money, they'll think in that point, and they think as a curse. But recent days they are giving more priority for the girl children's. And not only that, approximately 3 lakh girls under the age of 15 years are married and also have become a mother in our country, in India. And more than 50% of married women between the age group of 15 to 49 have affected with the anemia and nutritional anemia. Anemia means no blood. If there is no blood, a person cannot survive, a person cannot live, because there is a life in the blood. If there is no blood, there is no life. Simple. So many women, that is married women, nearly 50 percentage of being affected with the anemia, that means no blood, caused by the iron deficiency, which has contributed to 19% of maternal deaths. Maternal deaths means the number of pregnancy women dies during the delivery, that is called as maternal deaths, because there is no proper healthcare facilities for the women. So 19% of maternal deaths takes place in a country. And frequent abortions also a major cause for the maternal morbidity. Many number of married women, they are affected with one or the other diseases, that is prolonged illness, which is called as a morbidity. And why they suffer from the morbidity means because of due to the abortions which causes many problems to the woman. And not only that, health is a basic human right. Every person should get a proper health care facilities, and it is a basic human right and an important public service. The government should realize it, and it should provide the basic health, that means the rights of the people should get it. Success of the battle against disease is directly depend on education and efficient health infrastructure. When we have a efficient infrastructure, health infrastructure, there will be a good improvement in the health sector. And hence it is necessary to create awareness of health, personal hygiene, cleanliness is very important, and along with that provide efficient system like telecom and IT sectors play an important role in creating the awareness. So now we have come to the conclusion of the chapter infrastructure, both economic and social. It is essential for the development of a country as a support system. It directly influences all economic activities by increasing the productivity of the factors of production and improving the quality of life. Thank you for watching.